All right, so let me ask you something. Would you let or want someone to inject your, say, brain surgeon's face if they basically learned how to do it on YouTube? I mean, for me, probably not. But honestly, something kind of like this is happening in the aesthetic world right now. So over the last 10 years, Botox and fillers just skyrocketed. It's been like an explosion of them. Med spas are literally everywhere. Every town has multiple places that are offering injections. And listen, I'm not saying that's automatically a bad thing. A lot of talented people work in aesthetics. But the truth is the demand for these treatments grew way faster than the training and the oversight did. And injecting faces might look like it's simple on Instagram. You see someone with a syringe, a few quick little injections, and a before and after, and boom, you're done. But that's not the reality. Medically, it's not actually simple at all. Injecting filler into a face is not like putting on lip gloss. The face is full of arteries that supply blood to the skin, to the eyes, even parts of the brain. If filler goes into the wrong place, it can block blood flow in a matter of seconds. Someone can go blind, and people unfortunately have gone blind in the past from filler being injected. So the person that's holding the syringe really, really matters, matters a lot. And so today we're going to talk about something that's a little controversial: who should actually be injecting faces, and why the med spa boom has created a situation where patients sometimes have no idea what kind of training their injector really has. This isn't about attacking anyone. It's really just about transparency, because at the end of the day, when someone injects your face, that's a medical procedure, and medical procedures deserve medical expertise. All right, so let's zoom out for a second and let's talk about how we even got to where we are right now. Because the aesthetic industry, it didn't slowly grow over time. It kind of just exploded, like I said. Botox used to be something that people whispered about. Like 15, 20 years ago, patients would come in and say it like almost under their breath: do you do Botox? Now it's just totally normalized. People talk about it at dinner, at the gym, at group chats. It's just part of normal societal conversation. And social media poured gasoline on that. You have Instagram, you have TikTok, before and after videos, influencers talking about their treatments. Suddenly, everyone is aware of injectables. So the demand skyrocketed, and whenever demand skyrockets, business follows. So med spas started opening up everywhere, every town, every strip mall, every city block. And again, some of these practices are wonderful and they're excellent. There really are talented injectors out there. But the reality is that the industry grew faster than the systems designed to train and regulate the people who are actually doing the procedures. And that's where things get complicated, because now we're doing millions of injectable treatments every year in this country. Millions. Okay? And in some states, the barrier to entry is actually very low. The regulations around who can inject, how they're trained, what kind of supervision they need varies dramatically depending on where you live. So you can have one state where training is very structured, the physician oversight is clear, and another state where it's pretty loose. And the average patient really has no idea. From the outside, every med spa looks the same. It's a nice office, nice lighting, a treatment chair, syringes. But what patients don't see is the training that's behind the person that's actually holding that syringe. And so that's where the conversation about safety should begin. So what do the laws look like across the United States with Botox and filler injections? So injections are legally considered medical procedures, which means that they have to be performed by licensed healthcare professionals. Now, the exact requirements vary dramatically, like I said, state by state, which really is part of the problem. So who can inject? In many of the states, it's a physician, a nurse practitioner. It can be a physician's assistant. It can be a registered nurse, often with supervision. In some places, even a licensed practical nurse may inject under delegation from a physician. So another thing that most patients don't realize is that the rules for injectables completely are different depending on which state you're exactly in. So there isn't one national set standard. Every state medical board basically decides their own rules. In some states, the regulations are strict. You need physician oversight. There have to be structured protocols. Sometimes the doctor even has to be in the building on site. But in other states, it's much looser. There are places that a nurse can just inject Botox and filler as long as there is a physician who's technically delegated that authority. But the physician might not be in the office. Sometimes they're not even in the same city. Sometimes they're not even in the same state. They might just be listed as the medical director on paper. And the training requirements vary a lot too. There is no universal standard for how someone learns to inject. Some people go through very extensive trainings. There are anatomy labs, there are cadaver labs, mentorships. Other times it can just be a 1 or 2 day weekend course, literally 1 or 2 days. So what ends up happening is you have this massive industry doing millions of injections every year, but the training and oversight look very different depending on where you go. And most patients assume that there's some kind of national medical standard that's behind it, but there really isn't. So now here's the part that most patients never hear about, because when people think about Botox or fillers, they think of it as cosmetic. They think of it like a beauty treatment. But medically speaking, injecting a face is not just cosmetic, it's anatomy. And facial anatomy is complicated. Your face is full of arteries that supply blood to the skin, to the eyes, to deeper structures. And when someone injects filler, they're not just putting volume into the skin, they're navigating a very intricate vascular map. Every time that I'm injecting, I'm thinking about the depth, about the vascular anatomy, about where the arteries are likely to be in that patient's face. There are very specific danger zones in the face where arteries run very close to where we inject. For instance, the nose, the glabella in between the eyebrows, the tear trough under the eyes. Injecting filler under the eyes is basically navigating arteries that supply blood to the eye. Even there are parts of the cheek. If filler enters one of those arteries, it can block blood flow, and that's what we call a vascular occlusion. And when that happens, the tissues that the artery supplies suddenly isn't getting any oxygen anymore, or very little oxygen. And that's how you get skin necrosis, where the skin tissue actually breaks down and dies. And in some rare cases, if filler travels through certain arteries that connect to the eye, it can cause blindness or it can cause strokes. Now, again, these complications are rare, but they exist and they're real. And managing them requires understanding exactly what artery you're dealing with, what plane you're injecting into, and how to reverse filler immediately if something like that is even close to happening. So that's why the training matters. Now, something that almost never gets talked about when we're discussing Botox and fillers is the anatomy, actually, because when patients see injections on Instagram, it looks very straightforward. You have a syringe, a couple of quick injections, and then you get a before and after. But what you don't see is what's actually beneath the skin. The face is incredibly complex from an anatomical standpoint. There are arteries, nerves, fat compartments, muscles, and all of these structures sit differently in the layers of the face. So when someone injects filler, they're not just placing product into the skin, they're choosing a specific plane in the face. If it's too superficial, you get lumps. If it's too deep, you miss the structure that you're trying to actually support. And if the product goes to an artery, like we said, then it gets very complicated and complications happen. So understanding anatomy is really the foundation of safe injecting. And this is where the training conversation becomes important. A lot of injectors enter the field through short aesthetic courses. Sometimes it's weekend training. Sometimes it's through shadowing another injector. Sometimes it's online modules. And those courses can absolutely introduce people to injectables, but they're not the same thing as years of anatomical training. In medical school, we spend years studying anatomy. Not just memorizing diagrams, but understanding how the body is structured. And then residency, you see it clinically. You're working with anatomy in real patients, in procedures, sometimes in surgical settings. Many physicians also train in cadaver labs where you actually see the arteries, you see the nerves, the tissue planes in 3 dimensions. And that kind of training gives you a very different understanding of the face. Because once you've seen the vascular anatomy up close, you realize how small the margin is for error. And so that's why I say is that you can't master facial vascularization anatomy in just a weekend course. Injecting a face safely requires understanding what you actually can't see. So now this is where the conversation can get a little sensitive. So let's just brace ourselves, okay? Let's listen to this whole thing, because when people hear a physician talk about injectables, sometimes they think, oh, okay, the message is that it's going to be that only doctors should be the ones who are injecting faces. And that's not the point, okay? There are very skilled nurse injectors who are out there. Some of them have years, decades of experience and have incredible technique. The real issue isn't the letters after somebody's name. The issue is the training and what happens if something goes wrong. Because when filler is injected and there's a complication, it's no longer cosmetic. It now becomes a medical emergency. If filler enters an artery and blocks the blood flow, the tissue that artery supplies isn't getting oxygen, and the clock starts ticking immediately. In that moment, the injector has to recognize what's happening right away, and you have to know the signs. You have to understand the vascular anatomy. Treatment needs to start right away. That can involve dissolving the filler with hyaluronidase, sometimes in large amounts. Sometimes you're using medications that improve blood flow, like vasodilators. You can use steroids in certain situations. In more advanced practices, we use ultrasound to actually visualize where the filler is sitting and where the vessels are. So managing a complication is a lot more than just dissolving a product. It's understanding physiology, circulation, and understanding tissue survival. And so then this is where medical training can make a huge difference. In med school and residency, you're constantly learning how to recognize problems and intervene quickly. My background is actually in anesthesiology, and in anesthesia, you're trained to recognize and manage emergencies within seconds. Blood pressure drops, airway problems happen, medication reactions, they happen within seconds. You're always watching for early signs that something is changing before something bad really happens. And that mindset carries over to how I individually practice aesthetic medicine. When I inject, I'm not just thinking about how something is going to look. I mean, I'm thinking about that, but really I'm thinking about the safety of what I'm doing, where the vessels are likely to be, what plane am I in, and what I would do immediately if in the next 2 seconds something doesn't look or feel right. A wise surgeon who I worked with once had said to me that great injectors don't just know how to create beautiful results, they also know how to recognize and manage complications. And I completely agree with that. And at this point now, I just add to that the best outcome in aesthetics is a beautiful result, but the most important outcome is the patient's safety. So let's talk about Botox for a second, because Botox actually has one of the best safety profiles of almost any cosmetic treatment that we do. It's been used for decades. Millions of treatments are done every year, and when it's used correctly, it's extremely safe. So I want to be very clear about that. The goal of this conversation isn't to scare people away from Botox, but Botox is also one of those treatments that people sometimes assume is foolproof, just like a quick injection and that's it, you're done. And the reality is technique really matters with Botox because it works by relaxing specific muscles in the face. So if you understand the facial muscles really well, you can create beautiful, natural results. But if the muscle anatomy isn't fully understood, or sometimes muscle anatomy varies, that's when problems can happen. For example, if Botox spreads into the wrong muscle near the eyelid, that's when you get a ptosis. That's when the eyelid droops. If too much Botox is placed in the wrong area of the forehead, you get a brow drop, and that's where the eyebrows feel very heavy and actually fall over. Sometimes patients develop asymmetry if muscles are treated unevenly. And in areas like the neck, where Botox is sometimes used for the platysmal bands, the neck bands, incorrect placement or too large of a dosage can actually affect swallowing. Again, these complications are uncommon, but they illustrate that there's something important about this, that Botox isn't just about injecting a certain amount of units or a certain number of units. It's about understanding the muscle balance. It's about understanding facial movement and the individual anatomy of the patient who's sitting in front of you. Even the dilution matters. How Botox is mixed can affect how it spreads in the tissue. And every patient's facial muscles are slightly different. So the injector has to adjust their technique in real time. That's why I say Botox is very simple to inject, but it's not simple to master at all. So now something else that we should talk about is about complications, because if you follow aesthetics news or medical conferences, you'll probably hear people saying that complications from injectables are increasing. We see it all the time. And that can sound scary, but part of the reason is that it's actually pretty simple. We're doing way more injections than we used to. Botox, filler treatments, they've exploded over the last decade. Millions and millions of injections are performed every year now. So even if the complications are actually very rare and very low, the absolute number of complications naturally increases. It's just a numbers game. But there are also a couple of factors involved in this. One is the rapid growth of the industry. Aesthetic medicine has become incredibly popular, and that means more providers are entering the field. And whenever a medical procedure grows very quickly, the experience level across providers varies a lot. Another part of the conversation is that there's social media. So because social media has completely changed how people see aesthetic medicine, most people's exposure to Botox and fillers now comes from Instagram or from TikTok. You see these quick videos, someone walks in, gets a few shots, and suddenly there's this dramatic before and after that you're seeing. And those videos are very satisfying to watch, I know, but they're also just a tiny snapshot of what's actually happening behind the scenes. Social media, it rewards results. It rewards these huge transformations. But what it doesn't actually show you are the consultations, the planning that's involved in it, the anatomy considerations, and it definitely doesn't show you the complications. Those do not go viral. It also creates this feeling that treatments should be quick and easy and casual. Like you can just go in during a lunch break, get a syringe of filler or two, and just walk out, no problem. And sometimes it is that straightforward. But the reality is that aesthetic medicine is still medicine. There should be thought behind the treatment plan. There needs to be a discussion of the risks and careful technique. Honestly, the best aesthetic work actually looks very boring on Instagram because subtle, thoughtful results don't always make dramatic before and after videos or snapshots. So, if you're a patient thinking about Botox or filler, how do you actually choose the right injector? Because from the outside, most med spas look pretty similar. Nice office, beautiful photos, before and after results. But what you don't see is the training behind the person who's holding that syringe. So there are a few things that I always encourage patients to ask. First, who's actually responsible for the medical care in that facility? Is there a physician who's involved? Where are they? Are they actually practicing in the clinic? Where are they if something unexpected happens? The second is the training of that person. How did that actual injector learn to inject? Was it a short course? Was it mentorship over time? Do they continue to train in anatomy and technique? When was their last training that they took? Aesthetic medicine evolves very quickly, so continuing education really matters. Another thing that I look for is how the consultation is handled. A good injector doesn't just look at the wrinkle and say, okay, let's put filler in there and that's it. They're looking at the entire face, the structure, the movement, the proportions, the skin quality, the texture. A good consultation, it usually takes time and involves questions and planning, sometimes even saying no to certain treatments. And the last thing is something patients almost never think to ask: the complications. If something goes wrong, does the practice know how to manage it? Do they have hyaluronidase available if filler needs to be dissolved? Do they have protocols for vascular occlusions? Some advanced practices use an ultrasound to evaluate filler placements and anatomy. Do they use an ultrasound? Do they have an ultrasound? Those things tell you a lot about how seriously a practice takes about safety. Before we wrap up, I want to leave you with one simple idea. Aesthetic medicine can be incredible, and it is, and have beautiful results, which it should. Botox and fillers and lasers, when they're done thoughtfully and safely, they can make people feel just more confident and relaxed and comfortable in their own skin. But they are still medical procedures, and sometimes the industry forgets that. When someone injects your face, they're not just creating a cosmetic result. They're working with anatomy, with blood vessels, muscles, and real physiology. So the most important thing isn't the brand of the filler or the number of units or even the price that you're paying. It's the training and the judgment of the person who's holding that syringe. Beautiful results are important, but the safety always comes first. Thank you for spending this time with me today. This is the Line Eraser Podcast, where we talk honestly about beauty and aging and the medicine behind aesthetics. If you've enjoyed this podcast, this episode, make sure you follow the podcast so you don't miss the next one. And if there's a topic you'd like for me to cover in the future, I'd love to hear from you. I'll see you next time. I'm Dr. Carol Eisenstat. And this is the line eraser.